Hi, I'm Dr. Cole Hosenfeld with Apple Healthcare Group, and I'm here with one of my partners, Dr. Bradley Gipson, who's a foot and ankle surgeon. You know, Dr. G, one of the things that we see so much of is neuropathy. You especially, because you see neuropathic wounds and, with diabetes and whatnot. Can you take us through kind of what is neuropathy in a simplified approach?
Well, neuropathy is usually the patient presents with burning, tingling in the foot and ankles, sometimes the hands as well. They don't feel things they should often. Something as simple as a crease in your sock when you're walking around. Normally we would feel that. We would know, we'd just adjust our sock and that'd be the end of it. They can walk around all day and something as simple as that would cause a blister. And then they don't feel that they have a blister, gets infected, and that's how people get in trouble losing toes and things. And it can get so bad that I've had patients come in. One gentleman came in with a very swollen red foot, and I asked him, what happened? And he said, I don't know, doc, it's just been that way for about 3 days. And I took an x-ray, and he had a sewing needle stuck up in his foot that he had
feel it.
No, he had no idea. And that's how bad it can get. Usually the early stages are just present as burning and tingling, or maybe just a little numbness and tingling that develops into severe burning pain. Most common, that can happen all day, but most commonly they notice it at night at first.
Gotcha. And so, one of the things that, 2 decades in practice that I've been frustrated with is we haven't had a lot of treatments other than there's some basic exercises, some basic treatments, and usually it's medicine, And so, what are those medicines what's the standard typical treatment that has been done? And what have your treatments, how have those evolved?
Well, so historically, it's been treated mostly just to treat the symptoms, control the pain. Medications like gabapentin or Neurontin and Lyrica are two probably the most common prescribed for that. And really what they do is affect the way the nerve communicates with the brain, and it kind of shuts off the pain level.
Kind of douses it.
Yeah, but it doesn't treat neuropathy. Okay, the most common cause of neuropathy in this geographical area is diabetes. Okay. There are other causes, but the most important thing with any treatment is directly related to your blood sugar level. If you can control your blood sugar level, a lot of your symptoms, not all, but a lot of them can improve. Oh, absolutely. But overall, like I was saying, the treatment has been just to treat the symptoms and not so much the neuropathy itself.
So I'm pretty excited about these new treatments you've brought in-house.
Uh-huh.
Can you talk about a little of this regenerative treatment real briefly?
Well, we talk about diet and blood sugar control as we talked about. Also, there's been a lot of research for many years about light therapy being very effective. We have some light therapy boots that we apply to help increase circulation to the small blood vessels that feed the nerve and help it to heal. Vibration therapy has also been shown to be very effective. We brought that in-house. We're also doing some injections with PRP, which stands for platelet-rich plasma. Our platelets have a lot of growth factors in them that help us to heal, and we draw that from the patient. It's the patient's own blood, and we concentrate that down and inject it near the nerves to get them to stimulate to hopefully heal.
It's a small needle. It's pretty simple, so
right.
Really patients, that's not very painful for them.
No, it's not.
And so, I know we're having a talk here soon.
Yeah.
We're going to start having talks to educate people about this. And I think that's coming up pretty soon.
Mm-hmm.
And that's the whole goal of that is to go through what does that process look like.
Right.
Right. So a person can make an informed choice.
Right.
Right.
Exactly.
Well, thank you. For more information, or if you'd like to come to our seminar, please go to applehealthcaregroup.com.